I would like to welcome everybody to the AARP APDR Roundtable for today, and it is on the topic of the AIRP new hybrid format, a discussion of benefits and challenges. I am Carolynn DeBenedectis. I'm from the University of Massachusetts, and I will be moderating this session. I am delighted today to be joined by my wonderful panelists who have all kindly volunteered their time to be here in order to help inform PDs about the benefits and challenges of the new system. From the AIRP, I have the Physician-in-Chief, Dr. Mark Murphy. Also from the AIRP, I have the Associate Physician-in-Chief, Dr. Maria Manning. I have two chairs to share the chair point of view. Dr. Donald, sorry, nope, that's wrong, my bad. Dr. Max P. Rosen, chair at the University of Massachusetts Medical Center. I also will have Dr. Eric M. Walser, the chair at UTMB Galveston, Texas. I will have two program directors, Dr. Rustain Morgan from the University of Colorado and Dr. Donald J. Fleming from Penn State. I will have two residents, specifically chief residents, sharing their experiences with the new format, Dr. Taylor Pomeranz from Penn and Dr. Daniel Howard from URMC Rochester. So again, thank you everybody for joining us today. And we are going to start off with Drs. Mark Murphy and Drs. Maria Manning to share, the thoughts and the reasoning behind the new AIRP format and how they arrived at this new format. So please take it away.
Can you see my screen?
Yes.
Okay, great. So thank you, Carolynn, and we want to thank the APDR for this forum to discuss this very important subject amongst many of the stakeholders and to get everybody's opinion about how best to move forward. Just as a little historical perspective, I've just shown you this slide, and I think hopefully we can all start with an agreement that what we all want and strive for is the best educational program possible that we can provide in teaching radiologic pathologic correlation for our residents. Our initial hope was, after this was all over, is that we would return to in-person learning, and certainly because of concerns and reasonable and good concerns from our advisory committee and from at the time our advisory board, we initiated a survey for the attendees in the course, the virtual course in 20 and 21, and just asking them what ways they learn best, and about 40% of that group actually learned best in person was their information. And we did an informal poll of not an insignificant number of chairs, and I've just shown you the percentage. Over 90% favored at least some return to in-person courses. Also within that survey is that 60-40 split that we saw. And really, in order to accommodate all of our stakeholders and the residents, that's really how the thoughts that went into trying to devise our future for academic year 2022. And for our 5 courses, that really led us to having 3 virtual courses and 2 in-person courses. And part of it was also to accommodate the larger programs who might have more difficulty in scheduling for their larger number of residents as well.
So really, the rationale that we use, as Dr. Murphy said at the beginning, is our primary goal is to determine how best to educate our residents in RadPath correlation. And so we really focus on how the residents will learn best, this incredibly important component of the residency. The literature that exists, and there's a relative paucity, right? Most of the literature was done early on in the pandemic, discussing how different programs were going to handle the challenges of educating our residents during a pandemic. But there has been a small amount of literature published since then about the residents' experience with these changes that we've enacted during the pandemic. And these surveys have consistently shown, and this literature has consistently shown, that most residents prefer at least some in-person learning component, which informs the reason why many of our faculty have returned to in-person to provide on-site teaching. We're not, reading remotely anymore as often, and certainly at my own institution, where there are more of us on site to provide an in-person complement, because it's an important part of the education, and the residents prefer it. Most educational models from elementary school all the way up have returned to entirely in person with some virtual complement. In fact, most of our national and international meetings have returned or intend to return to in person, including the AUR. And so I think that the concept is that the learning is improved when you are in person. And it's not just the lecture. There's a lot more educational benefit to an in-person site, which is, why I'm going to go to the meetings that are upcoming in person. So, our rationale is really focused on how do we best educate our residents, and the literature supports in-person components.
So just to initially talk about the advantages of in-person learning, I think one of the more important is the learning environment. Much easier to be interactive. And I think the second bullet is particularly important. One of the things I like to ask many academic radiologists, many people on this Zoom meeting is, why are you going to the AUR, APDR, or any other meeting going back? And I think, we could all listen to didactic lectures on Zoom, but it's that interaction. That's the reason I go to meetings, is that I will be able to talk at breaks or some other time with my colleagues and say, is that the way you do it? Is that your experience? And that's a really hard thing to quantify, what learning goes on in that really peer-to-peer learning. And I think you also, I think probably all of us have attended Zoom meetings, and you're also trying to read in your department, right? I know that never happens, but you're distracted by a lot of different things. And I think if you're offsite and not trying to do that, it's a much better learning environment also.
Right, and then just from an accountability standpoint, I think that historically, the APDR has had valid concerns about how do we document attendance and engagement of the residents in the course. With Zoom, it is very, very difficult. As Dr. Murphy just said, it's very easy to become distracted. With hundreds of people on a call, you can't demand that cameras are on. We can't see the residents. We can't, see their engagement or at least assess it. And it's very easy to kind of log in and tune out. And so it's really hard for us to even know that we're even engaging with the residents during the lectures to be able to report back to the APDR that we have captured their attention and attendance during their course.
Yeah, getting back to professional networking, I think it's one of the things, as I mentioned before, that's really difficult to quantitate, but it's really vital for how we learn and how we learn optimally, and to emphasize different points that are made during perhaps a didactic lecture. And it also provides a unifying bond to generations of radiologists also. I think we have tried, and I think I've heard from many other people that have tried to do this professional networking on Zoom meetings or online, and at least we have been universally a failure in doing that, and I think I hear that from many other people. That's a very difficult thing to reproduce, is that professional networking. Teacher satisfaction also, as Dr. Manning mentioned, it's very hard to gauge any information about how engaged the people you're lecturing to are. You can't judge body language, you can't make eye contact, and it also has a significant impact on teacher satisfaction. And for us, it would have implications on recruitment and retention. And the more engaged you are as a teacher, it's really a two-way street. You'll have an improved course content as well.
We acknowledge that there definitely are disadvantages to the in-person course and in-person learning. And I think that this is what has been the struggle that most programs are facing right now. It is, convenience and cost are clearly factors. You have to travel someplace else and you have to live someplace else, which is difficult. And then you have the anecdotal reports of resident preference, which I assume that we'll hear more coming up. I think that the counterpoints are that are a couple. And this is kind of where we really want to just make sure we're providing a balanced presentation to the residents when they make choices. So current residents, people who are currently, 2 minutes, okay. Current residents, people who are currently deciding if the programs are allowing the residents to decide for themselves which course they're going to attend. Current residents don't know what it even means. They don't know what the course is. They don't know what the in-person course is. When when you're talking to residents that haven't been there, they may say, sure, I'd rather stay in my pajamas and watch a screen versus go someplace else. But when you talk to people who already attended the course, many people, as Dr. Murphy's already said, will refer to this as the best experience of their academic careers and or residency programs. And, and it's not just the lectures. And it's very hard to explain, and our goal is to explain to the residents just what they are choosing so that they're making informed decisions. We regularly make decisions in residency programs that are not always the preferred choice for residents. And I think that this is really well discussed in the article that's at the bottom, that sometimes we have to make the decisions because they're the right decisions for the resident, and they find that out later. And I don't mean for that to sound paternalistic. It's just sometimes we have to make decisions that are not popular, but are the right decisions. So I think that from our standpoint, I think that, what we really want is, and the reason why we're eager to participate in this roundtable, and we were very happy that Dr. DeBenedectis, recommended this, is that, you all have the opportunity to go back and you'll talk to your residents when they make their choices. And what we ask is that you really consider and present a balanced presentation of what the meeting can be virtually and in person, the advantages, the true advantages and disadvantages. And I think that the educational benefit of attending the course in person absolutely exceeds the virtual course. We do recognize that for some residents, it's just impossible to travel. And when we're happy that we have an alternative for those residents, but we would encourage as many residents that can attend in person. They'll just have a better experience and they'll learn more.
Wonderful. Thank you, Dr. Murphy and Dr. Manning, for that wonderful summary. I appreciate that. So now that we have gotten all the data and background on the current AIRP structure, I would like to talk to people who are on the ground dealing with why residents are going, why residents aren't going, challenges and benefits and things like that. So I want to start with the chairs. First, we will start with Dr. Max P. Rosen from UMass.
Hi, everybody. Thank you, Carolyn, for asking me to participate. Let me make sure I get. Great. Can people see my screen? Great. Okay. So in full disclosure, I had not talked to Mark or Maria before I prepared my slides, but I think pretty much from my chair's perspective, I'm just going to echo a lot of the points that they made. I'm the chair at UMass, as Carolyn said, and I'm going to be speaking in support in favor of maintaining the in-person option and why I think it's important. I think first of all,
Dr. Rosen, can you just put it in presenter mode so they can see it bigger?
Sorry. Let's try. Did that work? Is that no? Okay.
If it doesn't work, it's okay. I just thought it would be bigger. You're good.
Yeah.
It's all good.
Sorry, I think one minute, because I have two screens here. How's that? Actually, you know what?
No, that did sound weird. Don't worry, you might be on a Mac or something.
I'm sorry. 1 minute. You know what? How's that? Did that do it?
No.
Okay. Can people see the slides? Yeah. All right. You can't see anything. Okay. 1 second. Sorry.
I tell you, there's a button. I've done this before where you can, if you want a dual monitor setup.
Yeah, I am. So
there's a button that you can click that will swap what's the presenting monitor and what's where it's loading like your view.
How's that? Does that work now?
That's better. Yeah, you can go to the top and do duplicate slideshow, Max. See the duplicate slideshow? If you hit that, you'll be perfect.
So you're not seeing the full slide yet?
Well, I see the full slide. This is good. Let's not mess with it. I can see the slide.
How's that?
worse.
All right, you know what? Okay, I'm sorry. This is,
All good.
how's this?
Yay!
Okay, all right.
Perfect.
Okay, all right. Okay, so, and if I had gone to AIRP, I would be able to handle the dual monitors and the Zoom better. Yeah. So I think really most importantly, it separates the AIRP learning experience from the routine of Zoom, that we're all living in. It facilitates in-person connection with the faculty, for Q&A and also networking. I think it's a good opportunity for residents to interact with, the world-class faculty, find out about different programs, if they're looking to think about, what their subspecialty is going to be, maybe make connections for fellowships. It blocks out, focused time for full devotion to the learning experience. I think we all, sit on Zooms and do email, and by actually being there physically in person, you're present and you're focused. It also facilitates, networking with residents from other programs. And that just doesn't happen, on Zoom with chat rooms. It happens by hanging out, before or after the lecture or going out to dinner with people. It's a completely different experience. And I think it also sends an indirect message that radiology is more than sitting alone in a dark room looking at a computer screen. I know, from my point of view as the chair, I would estimate that maybe about 20% of the workforce now who would normally, get up every day and come to a bricks and mortar academic department are now choosing to stay home and do teleradiology. And I think if we have really one of our marquee learning experiences only be remote, it sends a subtle or not so subtle message that we are supporting radiologists, becoming remote providers, and that we don't value the in-person connection. The hybrid option is still available for residents who choose the hybrid option, or for financial or other reasons, really aren't traveling would be a hardship. I think it will differentiate your program for some applicants. I think for applicants who understand the value of the in-person learning, being able to offer this to your residents is a real plus. And then I had to put this in because of Carolynn, but my Vice Chair of Education wants me to fund the in-person option. One thing I've learned about being a chair is if you have happy vice chairs, my job is very easy. But even if Carolynn didn't want me to support this, I would still support it because I think it's very important. Thank you.
Wonderful, thank you. Yeah, I think it's something that I'm just always a fan with the residents of, that we be supportive of whatever learning style they learn with best. So yes, I'm lucky to have a chair that also supports whatever learning style they learn best. So thank you very much, Dr. Rosen. Next, we will move on to our next chair, who is Dr. Where'd it go? Sorry. Dr. Eric Wassel from UTMB Galveston, Texas. Thank you.
Well, let me start by saying, if you know Dr. Walser, you'll know that I am not him. Dr. Walser is my chairman, and I'm the program director for the radiology residency, actually. But he asked me to speak because I was closer to AIRP and thought that I could provide more insight into this discussion. And I actually started by going to my residents, my third-year residents and some of my fourth-year residents who've recently done the hybrid course, and getting their input on their experience with it. So that's kind of where I'm going to be speaking from. I didn't prepare a PowerPoint slide, but I'm just going to speak briefly about it. First thing I'll say is the original two speakers were quite on point in a lot of the things that they bring up. And one of the things that I want to mention, I've been lecturing for the last several years for AANS, the American Association of Neurological Surgery. And I would say, from a speaker perspective, I think that having an in-person meeting is much better. I personally don't really get anything out of giving, particularly pre-recorded lectures, but even Zoom lectures, because of all the things that have been previously mentioned. I mean, there's no engagement. There's really no way to get a back and forth. You know, you can say, raise your hand, but it really just doesn't happen, you know, and I think a lot of that has to do with human psychology. I mean, we see this in our residency interview season, obviously just concluded. And it's the same way, you know, things that people were talking about regarding night before dinners and things like that. You don't, the Zoom format, if you have somebody who's maybe introverted, even somebody who's extroverted, they don't always want to be the person with their hand up, drawing attention to themselves, you know, where there's a big screen of people. So I think there's definitely something that's lost. And I think that the concern that the quality from the presenter side will decrease is real. I think that's real. I mean, as a presenter, I have much less motivation to give virtual lectures than I do when I'm giving in person. On the flip side, there are many reasons why the virtual format, again, as has been brought up, is useful. And I think one, because I don't want to just be overly repetitive, but I do think that one that hasn't been addressed yet that really is something that we all need to think about, not only in terms of AIRP, but just in terms of education moving forward, is the shift in learning styles as we progress, as generations change. I see, you know, I'm not that old. I'm older than I look. I'm 40, but you know, the newer generations of people typically have shorter attention spans. They learn differently. They grew up in the era of Instagram and TikTok, and you know, everything should be sound bites. And the idea of attending, you know, back-to-back hour-long lectures from 8 to 5 for a full month is not something that, you know, in the current milieu really meshes with the way many residents learn. So I think that I think that we should be careful jumping to conclusions to saying things like, residents will get more out of it necessarily by being there in person. I think for a certain type of person, that's absolutely true. And you definitely can't replace things like networking and things like that. But, you know, and again, this is from one of my residents was saying that the ability to take breaks, and this is why I kind of support the hybrid option. Like, I think you should definitely be able to go in person. I think if you want to do that, I agree that that may make your program stand out. But the ability to watch lectures virtually, you know, on the evenings or in the evenings and the weekends, you know, at your own pace. I mean, one of the things that one of my residents brought up is he was like, look, some speakers speak slowly. So I'd like to be able to just watch what they have to say in 1.5, 2 times. It's more efficient to me. So I think that those are definitely things that should be considered and that are benefits of the virtual course. Family is a thing. This is something that, you know, is a more specific reason why somebody may not be able to travel, right? You have young kids, and these are issues that are coming up all the time now, you know, with the ABR, you know, not only the ABR, but, you know, the ABR just went along with the ACGME in terms of like how much time off you can take. Women in medicine, you know, it may be more difficult for mothers to go away for a month at a time and leave their family. Certainly, you know, they couldn't take young children with them to DC and go in person. So, I mean, these are all things that really need to be considered as we move forward as a specialty. So I think that, and the discussions we're having about AIRP are the same discussions that are going to be mirrored about residency interviews moving forward. I really don't see us ever going back to, you know, a solely in-person conference without the option for virtual attendance. The other thing I'll mention just about accountability, I hear that, but to be honest with you, there's no way to track. If a resident doesn't want to be, if a resident wants to go in person to DC and not show up to the conference, that's something that they can get around. You know, we have to treat people as adults as well, because trying to say like, oh, you know, you have to take your buzzer and like log in. I mean, in reality, if somebody just wants to go and hand it to somebody like, hey, are you going today, and go to DC and take a month-long vacation on the department's dime, there's not a real meaningful way to stop that. So my take is that in-person learning offers a huge advantage to the lecturers for sure. But again, lecturers are not there from 8 to 5 the entire month the way the residents are expected to be. They're giving like individual lectures, and it's much more active for them. But I do think, yeah, and that's I'm getting they're bringing out the shepherd's crook.
Yeah, thank you very much. Your insights have been very valuable. Now, the point of us having the chairs was to say about funding. And so your chair was representing someone that had doubts about funding it if there's a virtual option, that why should we be funding this? Why should I pay all this money when I don't have to? Do you have any insight from your chair on that quickly?
No, honestly.
Okay. All right.
I don't want to put words in his mouth.
I didn't address the funding, but I think we're sort of a mid-sized department, and we're certainly not wealthy, but I think like any of these things, you figure out what it costs and you build it into the budget, and you work with your GME and the medical school to find the funds. So I think, at least my view is, if we can find the funds at UMass, other departments can probably find the funds if that's something that they want to prioritize.
Wonderful.
And again, just the status quo prior to COVID is that this was funded by most departments for the last however many years. So it's not.
Yep. There are some, I just want to represent all sides of the spectrum. There are some programs that do have trouble fitting this into the budget and have the opinion that, why am I sending them, and paying when they can do it, and I know it's a small amount, but I just want to make sure all of the opinions are represented. Okay, let's move on to the additional program directors. Thank you both so much. So next we will move on to the program director from Penn State, Dr. Donald Fleming.
So I am a program director that's in support of the live format. And in full disclosure, I've been blessed to be a faculty at the AIRP/AFIP course for 24 years. So I'm a little bit biased in that regard. And certainly, as was pointed out, the benefit for the lecturer is significant, in my opinion, to be live. I think the biggest things for me have already been stated. I'm just going to restate some things about why being there is important. And I think the biggest thing is acknowledging the fact that despite that we're in 2022 with a lot of electronics and convenience that's afforded to us, is that we're still evolutionarily designed to be social creatures. We benefit from being around each other, and that's what drives us to attending the AUR course and in 3 weeks, as Mark already pointed out. And you can just look at your own lived experience. Just to go into a concert is way different than listening to a live album. It's just a completely different experience. It's enriched to be there in presence with other people, with the discussion that occurs afterwards, obviously, in between sessions. And I mean, just as an example, it's anecdotal, but one of my residency classmates met his wife at the course. And so they are married, still married. At least he's happy. I don't know about her. I will we'll see them in Nolens and at the Rankin Ray and confirm that she's still happy too. But as was been alluded to also, is that when you pay for it being live, you're signaling that it's really, really important. When you're committing to that, being able to be at the course and spending the money, is you're signaling to everybody that this rad path correlation is critical to radiology learning. So that is the end of my brief presentation.
Thank you very much, Dr. Fleming. I appreciate that. And next we'll have our other program director, who is Dr. Rustain Morgan from the University of Colorado. Take it away.
Thanks. So I first want to thank everyone for the comments so far. I think that we've touched on all of the major issues. It's interesting because I actually reached out to APDR asking why the hybrid format, what's the current stance, because the residents got very upset about it. So our residents, because we have anywhere from 8 to 12 per class, it's impossible for everyone to attend a virtual format. And what this really means is that the residents who end up drawing the straw to travel in person are facing a significant challenge that the other residents aren't facing. And to me, that's the biggest issue. I really feel like that's my bottom point there, this inequitable distribution of burden by not having an all virtual option. Now, I will concede that I had a great time at AIRP. I still have friends that I've talked with and text frequently from that experience, and I think it's great. However, I've struggled to justify to a resident that they have to leave their newborn baby and partner for a month because they drew the short straw and have to go to the in-person session. I can't do that to them. I think the financial costs reaching out to our residents, they estimated that they spent a total of over $4,000, not including the AIRP registration. We provide our residents $6,000 total in education fund. So most residents use, between the ABR fees associated with taking the core, they use all of their funds for AIRP because of the significant costs. I did reach out to former residents and asked, if there had been a virtual option, would you have attended, or residents who have graduated but did it in person? And the response was no. Most of them did have families, and they were the ones who were most adamant about they would have not done it in person. I met with our R2 class and we started the conversation about who's going to go. And I would say we were close to the edge of mutiny when we said that we couldn't fit everyone into the virtual options because they feel like they don't want to go in person. And I do think that there's some historical factor to this, right? The senior residents now didn't do the in-person, so you're not getting that perspective of, hey, I met all these great people, I had this great team building. But my R2 class is vehemently asking if we can just switch to a non-AIRP related RadPath correlative series. I know there are other programs out there who no longer attend AIRP, and I have my residents now very strongly demanding that we stop attending because of the in-person requirement. I do want to touch on one other thing. I think there's an East Coast bias here, which doesn't get talked about much. I had friends who were from neighboring states and they were able to drive home every weekend to see their families. Whereas those of us from the Midwest or West Coast, that you couldn't afford to fly home every weekend. That wasn't an option on a resident salary. And I think that is a significant challenge for some folks that we need to take into consideration. Now, I will say, all of that being said, that the real, what I would like us to see is to have an in-person option, 1 or 2 sessions, but have virtual options for every session, just so that programs can continue to participate even if they face these challenges. Thanks.
Thank you very much. That was a wonderful discussion. I appreciate all your insight. Next, I'm excited to hear from the people that we are all here for, right? We are all educators and we're all here to educate the residents. So we are going to hear from the resident point of view as well. So first, I would like to start with Dr. Daniel Howard, who is a former chief resident from URMC in Rochester.
So, hi there, I'm Dan, I'm one of the chief residents at University of Rochester. I just want to preface this by saying that I participated in the virtual course in the October-November session in 2021, so that was my personal experience. I guess I'll start by saying, my experience in radiology education, kind of from the starting point, has been entirely affected by COVID. So, at the end of my first year was when the COVID pandemic started. And that's really kind of hampered my ability to attend conferences in person. In fact, all of the conferences except for RSNA this past year have all been virtual for me. So I feel like I've kind of missed out on a lot of the interpersonal kind of engagement that you get from meeting with peers as well as kind of leaders in the field. And that carries over to AIRP. So I think missing out on the connections between residents is significant. Being able to touch base with folks at other programs, get an idea for how those programs are set up. It kind of offers you a little bit more leverage if you're trying to make a change at your program. You're better able to advocate for yourself and for your program when you know what other programs out there are doing. And it's the same for relationships between educators and residents as well. So being able to actually talk with some of the leaders in the field and get career advice, and as well as being just able to ask questions about the material itself. I think the ease of access kind of goes along with that, being able to just directly ask a question versus being able to type it into the chat. Sometimes it can be intimidating to try and either speak a question out loud on a Zoom format or enter it into the chat. I certainly seen where questions kind of get tossed under the rug or lost within the chat. So it does happen. I think to kind of along a similar point, engagement for residents participating in the course is definitely lower in the Zoom format. It can be easy to kind of put on a course and walk away. And even still kind of you're in your home environment. So there are a lot of distractions that happen in your normal home environment that, would not be present if you were in Silver Springs. So being able to kind of escape that normal environment and kind of go into a place where you're, kind of somewhat isolated amongst your peers and really in an immersive kind of learning environment, I think ultimately helps the process. And lastly, I'll just touch on the technical challenges that happen with, using Zoom, using PowerPoint. We even saw today, there are always going to be hangups in terms of getting things presented the right way. It happens at our institution. I'm sure it happens everywhere. No one's perfect, and you never know when technology is not going to cooperate. So, and it did happen a couple times during the course where things were interrupted, either by impending storms. There was at one point where they were worried about losing power and not being able to broadcast, or just not quite being able to get everything up and working in a timely fashion. So those would be kind of my reasons to advocate for in-person learning. I will say thoughts on attending RSNA versus, virtual courses. I got a ton out of RSNA. I was really happy to be able to go in person, meet with speakers, as well as some of the, I spent a lot of time with the engineers at GE, kind of talking about some of their technology, which I thought was really cool. That's not something that I would have really been able to do in a virtual format. So just being able to really access, folks and get more information than just, being able to enter into a chat or, have an email address. So yeah, those would be my my reasons for in-person learning.
Thank you very much. Those were some great points that you pointed out. I appreciate it. Last but certainly not least, we have another current chief resident, former chief resident, sorry, I can't remember what it said, but Dr. Taylor Pomeranz is also a former chief resident, sorry, from Penn. And they will give us their resident perspective as well. Thank you.
Hi, I'm Taylor. Nice to meet all of you. Yeah, so I'll just echo, I think, a lot of my points have already kind of been touched on, but I'm obviously representing the side of being in favor of continuing to offer a virtual and hybrid format. And, some of the reasons for that being, I think drawing a comparison to other in-person conferences is not quite fair in this case because as we've touched on, all of those conferences are about 4 or 5 days long. And this is a full, month-long conference. I think people still get a lot out of attending in person. I don't disagree with that at all. But, to kind of touch on what other people have said, it's just quite inaccessible for a lot of people to physically relocate yourself for an entire month for a number of reasons. First, I can tell you at Penn, in my class alone, we will be graduating with at least 14 children under the age of 5. In our class, 12 of 17 residents in just our 4th year class have toddlers and infants. And a lot of those residents were not planning on attending AIRP if it was only going to be offered in person. Just logistically would not have been possible. Some of our residents are caregivers for elderly parents or have pets, things like that, things that just make it difficult for them to be gone for an entire month, whereas almost anyone can be gone for a week and figure that out. I think financially, someone touched on, the financial burden. A lot of programs offer a stipend, but it doesn't even come close to covering your costs of relocating for a month. And the additional kind of costs that you incur from kind of leaving your home and still trying to kind of manage things there. And, a lot of people have touched on learning in person. And, I don't think anyone really disagrees that in-person learning is better, but I don't think we've really specified the type of in-person learning that's better. And I can tell you in my experience and many of my peers, there's not a huge difference between a didactic in-person lecture and a didactic virtual lecture. And, if we're talking about, in-person, engaged, active learning, teaching at the workstation, reviewing cases live, that's a different story. But my experience with AIRP was that the overwhelming majority of the content was purely didactic lectures. And, it's hard to do that for 8 hours a day for an entire month straight. As some people have said, I'll tell you my personal experience. My favorite session by far was Jamie Marco. He did basically case review lives with DICOM cases that he sent out beforehand that he gave people to review, and then he went through a systematic approach to renal lesions. And that was extremely educational, and I derived tremendous amount of value from that. And I remember everything that he talked about, and kind of as AIRP went on, I can tell you by the end, I don't remember much from the peds or the thoracic sections, in the 4th week, just because it's a tsunami of information and it's exhausting to be in didactic lectures for that long. I do think there's a value in the social engagement, and it would be worth considering, I think, having at least just a week where residents come to Silver Springs in the beginning to meet people and engage with each other the way that we do for other conferences. But beyond that, the other point I'll make is, so I was the scheduling chief for Penn last year. We have a large program, it's almost 70 residents. We cover 4 different sites physically. And it's a scheduling nightmare to try and basically coordinate letting people choose sessions that are only offered during certain months. We build our schedule almost 2 years in advance. And sending, if everyone wants to be virtual, packing, kind of taking people off service, like, half of our residents off of service for 1 month. It's just, we're talking like tens, hundreds of hours of work that people have put into building templates that has to get redone every single year, and also puts us in a kind of precarious situation in terms of actual coverage and call coverage and things like that, because we are concentrating so many residents into shorter time blocks who are being completely removed from their clinical duties. So I think those are kind of the main points. I don't think I have anything else.
Thank you. That was a lovely discussion. I really appreciate it. So right now what I'd like, I'm going to go over some stuff I see in the chat in a bit. I might not be able to go over all of it, but what my main goal is to get some Q&A. So I'd like people, if they have questions and stuff, to please put it in the Q&A, not the chat. I will go over some suggestions in the chat in a minute. While we wait for people to do Q&A, I would like to, I want to clarify some things. So as you heard, I want my chair to support both options because as an educator, I really believe people learn differently. And at our program, specifically in my department, in our residency program, we believe everyone's educational experience should be individualized to some extent. But I also want to come at it as the co-chair of the Diversity Committee at AIRP. I think a virtual option should always be there in some way. I am one of those people who had a very ill 7-month-old baby when I went to AIRP. I had to find a pediatrician. I had to bring my mother with me. I had to bring the baby with me. It was a horrible hardship. That being said, the lectures are phenomenal there, and the education I got was phenomenal, but I did have to miss some of it despite being there in person because of some, emergencies that sprung up, having a chronically ill child and a mother that wasn't quite equipped to handle it, taking care of her with me. So I want to always make it known that I do think for residents and in education that everybody has different learning styles, and that's why I wholly support my residents of choice, and I'm so lucky to have a chair that will fund it. But I also do want to point out that for a diversity inclusion perspective, there should always be some virtual option, because I do think that the hardships for some people are too much that trump the learning experience, which is really important. The other thing I want to point out is I think millennial learners are very different, and I have noticed that when they want options, but they don't always take advantage of some of the options. So a lot of people say, oh yeah, I want a virtual option. This has happened in my program. I want a virtual option. I want an in-person virtual option, but then they all choose the virtual option, which I empathize with other program directors. My residents have all actually recently chosen the virtual option, and that might not always be true. In 2 years, that might change. But I empathize with program directors as well as the AIRP, who might have done a survey where all these people said they wanted to come in person, and then they all might have changed their mind. So I think this is a very difficult topic. We're not going to find an answer today, but I think all of the wonderful input that and insight people have given has been great. So I have my first Q&A. So let's look at this. Is it possible to have a synchronous virtual and in-person session? The in-person session could be broadcast over Zoom, and the requirements for the virtual attendees would be the same as they have been for the virtual sessions. That way we would be 5 in person, 5 in person, and 5 virtual, and everyone getting to choose what they prefer. I think this would be a great answer for the AIRP people to start with, because I think that the logistics is up to them. But then I'd like to hear from others as well.
So
yes,
I can start.
Ahead.
Sorry. So the in-person and the virtual courses at the same time cannot be run concurrently because of the way that we organize the lectures. So we are live lecturing from 10 until 4 to accommodate all time zones during the virtual session. So I can't lecture in 2 places at the same time. Can we stream the lecture that I'm giving? Possibly, but the streamed attendees will have a very different experience than the virtual attendees. So in other words, and to go back to one of the points that was made earlier, I recognize that a lot of the lectures are didactic, but Dr. Marco is not unusual in wanting to do more case-based or more interactive lectures. It is very difficult to do in a Zoom setting. And so we have actually plans for the next in-person course to be far more interactive with a lot fewer of these 45-minute sort of didactic lectures. In fact, those have been shifting over time. So we recognize that sitting in a classroom for 8 hours a day is difficult. And so we are addressing that to have a more interactive live course. Now imagine that you're doing an interactive live course in person with people, and you have cases and you're streaming this. It's a different experience. And so the in-person course and the virtual course are not the same. So you cannot do both kind of at the same time. We have already provided the dates for the upcoming session. We actually identified the times that are best to actually be in DC to be in person. So currently, as it stands for the academic year 2022 to 2023, the live courses are the September-October course, and the March-April course. So, you know, both of those are very nice times to be in DC, and, you know, it allows us the opportunity to be in person. So yes, we have already determined the schedule, and, you know, we are going to try a streaming option in the March-April course. There are a lot of, if any of you have attended a virtual meeting, national meeting, it is a different experience being in person, as Dr. Howard mentioned earlier, and watching virtually. Your questions cannot be addressed. We're not able to moderate the chat as well as the people in the audience. You're basically just watching a lecture that's being given to someone else. So, it's impossible for us to do both at the same time. We really have thought about all of these options. I fully recognize that there are people who cannot travel for lots of reasons. So having a virtual option is crucial. We want to be as accessible to everyone that we can. And this is the compromise that we were able to come up with.
Yeah, I would just echo what Dr. Manning said. We are very concerned if we try to do streaming and live course that this people on the stream will be significantly shortchanged. And I think almost all studies have shown that that's a very difficult needle to thread for that. But we have had those discussions. And so I have a question for Doctors Morgan and Pomeranz, and thank you so much for your presentations. If we did such that you had 3 virtual only meetings, 1 in-person only meeting. And I think one of the important things about that is then we have a beta test, and then 1 meeting that is streamed, so you could attend it virtually, but is also live. Would those 4 courses alleviate scheduling difficulties, I guess, is my question to you.
Fantastic question. President?
I'll say that for us, because we have 8 to 12, I can make 4 sessions work on our schedule. However, I would guess that Dr. Pomeranz, with a larger cohort, that may be more of a challenge. So Taylor?
Yeah, I mean, anything you do to increase the flexibility certainly helps, you know. You know, that would certainly be, you know, positively received. It wouldn't solve the problem. You know, if it was at least consistently, the problem is residents having the choice, right? You know, I can tell you that this upcoming year of our 17 residents, all 17 of them have chosen to attend virtually. And, you know, I have asked over a dozen other scheduling chiefs through our AOR chat, and they've all told me that 100% of their residents are attending virtually. So, you know, I think it's probably the case that few enough residents will probably elect to attend in person, that it's easy to shuffle things around for 1 or 2 people.
So if you had 4 courses, could you have 4 of your residents, and one course would have 5 if they all wanted to attend virtually? The other thing I would just throw out there is we have an international attendance too, and we have heard from the international attendees that they are much more interested in attending live and being here. And so we have that group to talk about as well. And I would also just emphasize what Dr. Manning said. We have learned an incredible amount from doing the course virtually. And I think we're going to incorporate that when we go back live. And so I would just thank all the attendings for helping us learn how we can do these things better and be more interactive.
Dr. Manning, you've had your hand raised quite a while.
Thank you. No, I just had a question, and it's going to go back to how, you know, first, you know, we're offering residents a choice here, and it's unusual. That's different than in the past, right? Because there's only one option. So you're offering them a choice. And I think that the question is going to come down to how do you make sure that they're making an informed choice, right? So it's one thing to say, again, it is very easy for me right now, for example, I am doing a Zoom call from a farmhouse that I'm doing work on, and you know, I didn't have to go anywhere. I didn't have to change. I opted to do it this way because it was more convenient for me. But if I knew that it would be better to be in this room together with all of us, being able to engage and look at each other, and I knew that it was better for me to do so, would I have chosen to do that is, and so I think that the main point that we wanted to make in our presentation was to please please try to present both sides, the advantages and disadvantages of attending in person versus virtually. Not that residents don't know how to make that decision, but because they don't actually even know what the course is. And even in attending it virtually does not mean that you know what the in-person course is. I will tell you that just like we all have anecdotal evidence, I've also reached out to residents who are currently fellows because they were the last group of people to attend the in-person course. And these are people from across the country. And I've asked residents specifically who knew that I just wanted an honest answer. I didn't want the answer that they thought that I wanted. And I asked them specifically, can you talk to your fellow fellows and ask them what their experience was like, and would they have preferred to do it virtually or go in person? And uniformly, they would all, I'm talking people from all across the country, they loved being in DC, they loved being in the course. Yes, they went downtown, they checked out DuPont Circle, they did all the things that they do in DC, which they could not have done at home. And also they networked, and also they got the lectures. And so I think that if you ask other program directors who attended the course in person themselves, just like Dr. Morgan said, they kind of loved it. And so how, I don't know how we discount that experience. And I don't know, I think that it's important for the residents to understand that, so that when they're making their decision, they're not just saying, yes, it is definitely cheaper and more convenient for me to stay at home. 1000% we all agree. But the question is that the best decision to make for their education? And again, I think that, and if I could just make one, I would encourage you all to read the article that we put in the summary about the learning styles, because there actually has been a ton of research done on this sort of misconception that we all learn differently now. And Dr. Fleming mentioned this earlier. The way that our brains work hasn't really changed. The way that we use them and apply them and how we're distracted with all of our devices has changed. There are more options for distraction, but the way that we learn hasn't necessarily changed, just looking at psychological data. So looking at the research, there is support for the fact that we really haven't changed the way that we learn. We have changed kind of our expectations, but we haven't changed the way that we learn. So, I certainly would encourage everyone to read that article. I found it to be, that's just one of many.
Wonderful, thank you. I'm going to apologize to the acting Dr. Wassel because I was a little thrown when it wasn't him and I didn't get your name. Hold one second. I would like to say one thing. I would encourage the AIRP, because program directors do a lot and we're very busy, and I want to advocate for program directors to come up with maybe something that residents watch, testimonials, something like that about AIRP that might give them a greater thing, like a YouTube video or something, because I'm going to tell you, by the time I would get to them, a lot of them have made up their mind. So maybe something that comes with the sign up that is testimonials of this is why it was great, sample instruction, things like that might be good. Just a suggestion. All right. We don't have much time. I don't know if people can hold over. We have one more question, but it's more of a statement. But the acting Dr. Wassel, and please retell me your name. I apologize.
That's all right. My name's John Heymann.
John what?
Heymann.
Heymann, Dr. Heymann. Thank you.
I don't want to take up too much time. I just want to say that, going to AIRP in person is fun. I went when I was a resident, I attended. It's certainly an enjoyable experience for all the reasons you said about being in DC, in addition to the learning opportunities. And the point I would make is just very briefly about a lot of the points that people have brought up about people being disadvantaged in streaming or in watching the videos after the fact, as opposed to being there in person. And my short statement to that would be, if the residents are given the choice, then they are accepting and now I know you might say, as has been brought up, they don't know what they're missing out on if they only attend virtually versus in person. But that aside, if you have the option to attend virtually versus attend in person, then you're sort of accepting that, there may be, it's a pro and con that they weigh. So I don't think there's going to be a complaint. I think that the value of AIRP is the lecturers, honestly. It's the content that people really want. And when I talk to my residents, what they want is access to the content. They want, whether they see it virtually, whether they're even watching a live stream or whether it's recorded and they can just watch it after the fact, I think you'd be surprised. There's not a huge opportunity cost even to watching a pre-recorded lecture as opposed to, a recorded lecture as opposed to a live lecture in terms of being exposed to that content. And what they really want is to be able to have exposure to that for a longer period of time. Now, my question to you, and you don't have to answer this, something I put in the chat, is about the financial logistics of that for AIRP, because I get it. They're not going to want to pay the same amount to watch things virtually as they are to attend in person. And you still have to pay your lecturers and have people come in person to do that. So that's a different discussion. As I said, that's the problem that American universities are facing right now. You know, how does a small university keep its lights on, you know, and clean its buildings and all that stuff when people are learning virtually and don't want to, you know, pay the price that they would for attending in class?
Wonderful. Thank you. So I want to get to a couple things because there are a few very commentary things. So there was a wonderful point that got a lot of support in the chat, which is, would AIRP consider having residents come for 1 week and then do 3 weeks virtual? And I'm throwing that out there. We can talk about it in a minute over time, but I want to get all the things in time. Then also somebody brought up, when will we get dates for what options will be offered and when? Schedules are being built now and they would appreciate answers.
I've already answered that one.
Wonderful. If somebody could answer that.
I've already
Yes.
answered that one, Carolyn.
Yeah, so
I
the
saw that question come up
Right.
when
The
I'm
course
speaking.
dates are out there.
Thank
So-
you. I apologize. I've been trying to monitor too. If they're speaking. So then there's a comment, people continue to place emphasis on social component of the in-person session and physically being in C, but does this need to be for the entire month? Again, this a support of that kind of, is there a way to kind of break it up? I don't know the answer. I don't know if it's right
Yeah,
or
so-
wrong, but putting it out there.
Yeah, a couple comments. We now have organized the course such that each section is in a finite and designated point of time. So somebody could take, 2 weeks here and 2 weeks there and still get the entire course, whereas before it was all intermixed. So if you went to 2 weeks and came back another 2 weeks, you could actually see the exact same lectures. So there is some ability now to do that. We have actually had extensive discussions about having significant parts of it online, and then you would have multiple chances to look at it, and then coming to DC for a week to two, as Dr. Pomeranz mentioned. So those discussions are ongoing. I will guarantee you, we as faculty have extensive discussions. Sometimes I say arguments, that may not, but we have extensive discussions about this. So your input is appreciated, that you're thinking about the same things we're thinking about.
Right, and one of the comments in the chat also referred to having more durable material that is accessible throughout your residency, and we have absolutely talked about that. So, unfortunately, we have to do things in stages, and so the first stage was kind of reintroducing the in-person component for those that learn better that way, for those who want the full experience. The course is not going to be exactly the same in person as it is virtual. It can't possibly be, but at the same time, we are going to present the same basic information so that it's relatively balanced. But we are absolutely planning in the future to have more of a subscription service so that we're introducing RadPath correlation to you as a first year. We have information that's available to you throughout that you can address and review repeatedly throughout your residency to allow more penetration. So we recognize all of these things, and this is all part of our progress and our transition, but this is just the first step, is kind of going back to this format, which will, as Dr. Murphy said, the block formatting of schedules, which has changed for those who attended in the past versus those who've gone to the virtual course. We now have every single, specially by week. So MSK is 1 week with breast at the end, body is 1 week, neuro, chest, and peds. So we really have separated so that you could potentially attend 2 weeks in person and then do 2 weeks virtually during another course. It's a lot more complicated from our side, but I'm not on the registration side. I just try to educate. So.
Great, thank you. I want to try to wrap things up in respect of everyone's time, but I first want to say thank you very much to our panelists, the non-AIRP panelists, for bringing up such wonderful points and giving such wonderful suggestions to AIRP, the AIRP for presenting their research and data, and also for telling us all these background things we didn't realize they're doing to try to make everything better and more accommodating for everybody. And I think it's been a wonderful learning experience for me personally, and I hope it's been a wonderful learning experience for all of you. If I did not get to your comment in the chat, I apologize. I will try to go through the chat for the summary to make sure everyone's thoughts get in there. But thank you to everyone for attending. Specifically, I want to thank Kate Gibson, as always, for organizing this. She does so much work. She hounds me. It's great. But thank you again to Drs. Fleming, Dr. Murphy, Dr. Manning, Dr. Rosen, Dr. Heymann, Dr. Morgan, Dr. Pomeranz, and Dr. Howard. So thank you, everybody.
Thank you.